Hello, and welcome. You are watching Step Up Medicine's video on electrical conductivity. In Episode 3, we'll walk through the heart's electrical conduction system, the internal wiring that controls how impulses are generated and spread, ensuring each heartbeat is coordinated, efficient, and automatic. By the end of this episode, you should be able to identify the major components of the cardiac conduction system, describe the normal sequence of electrical activation in the heart, understand the functional importance of conduction delays and speed differences, link conduction events to the ECG, apply clinical relevance, heart blocks, arrhythmias, pacemakers.
The cardiac conduction system includes 5 key structures. First, the sinoatrial node, or SA node, located in the right atrium. This is the heart's natural pacemaker. It generates spontaneous electrical impulses that set the pace of the heartbeat. Next, the atrioventricular node, or AV node. This is located at the junction between the atria and the ventricles. It temporarily delays the electrical signal to allow the atria time to fully contract before the ventricles are activated. From the AV node, the signal travels into the bundle of His, which is the bridge between the atria and ventricles. The bundle then splits into the right and left bundle branches, which run down the interventricular septum. Finally, the signal spreads into the Purkinje fibers, which rapidly distribute the impulse through the ventricular muscle, triggering contraction. Let's follow the electrical signal through the heart. It begins at the SA node. This generates an impulse that causes atrial depolarization, leading to atrial contraction. The impulse then reaches the AV node, where it slows down. This brief delay is crucial. It gives the atria time to push blood into the ventricles before they contract. Next, the signal travels rapidly down the bundle of His, into the right and left bundle branches, and finally into the Purkinje fibers. This triggers ventricular depolarization, starting from the apex and moving upward toward the base, allowing blood to be pumped out efficiently. Each part of the conduction pathway corresponds to a specific part of the electrocardiogram, or ECG. The P wave represents atrial depolarization, initiated by the SA node. The PR interval reflects the delay at the AV node. The QRS complex represents ventricular depolarization. This includes conduction through the bundle branches and Purkinje fibers. Finally, the T wave shows ventricular repolarization. Together, these components provide a full picture of the heart's electrical activity in real time.
Let's recap what we've covered. The SA node is the heart's natural pacemaker. The AV node introduces a crucial delay between atrial and ventricular contraction. The bundle of His bundle branches and Purkinje fibers spread the impulse through the ventricles. Conduction speed varies between regions to create proper timing. Each ECG wave corresponds to a conduction event. Disorders of conduction can cause arrhythmias and may require medical intervention. Understanding the conduction system is key to interpreting ECGs, managing cardiac conditions, and appreciating how beautifully coordinated every heartbeat really is. Now test your knowledge with this quick question. Which part of the ECG represents the time taken for the electrical impulse to travel through the AV node? A. P wave. B. PR interval. C. QRS complex. D. T wave. Leave your comments in the comments below. If this helped clarify your basics, like and subscribe for more high-yield videos. Up next we will be taking a closer look at blood flow and hemodynamics. Thanks for watching, and keep stepping up your knowledge.